name's Pete Gorman. I'm a physician associate. Can I ask your name and date of birth, please?
Yes, it's Mark Reynolds, 26th of August 1966.
And how old does that make you, sir?
54.
Wonderful. I'm here today to carry out an examination of your knee, and that will involve me looking at your walking, which we'll do later, moving the knee and carrying out various examinations. I see you already appropriately dressed in shorts. Can I ask if you're in any pain, Mark?
Not at the moment, thank you, no.
And have I got your permission to carry out the examination?
Yes.
Thank you. So just observing the patient, the head is upright, shoulders are level, arms are nice and relaxed by the sides, the pelvis looks generally level, and I'm looking at the knee joints themselves. There's no gross redness or edema. I do notice, can I ask Mark, you've got a scar on the inside of your left kneecap.
Yes.
What is that?
Medial patellofemoral ligament reattachment and a lateral release.
And what year was that, Mark?
August 2012.
2012, okay. When I look at the bulk of the vastine muscles, that's the quadriceps, there's symmetrical bulk of the lateral and medial muscles on the right side, and on the left leg there's a little bit less bulk of the vastus lateralis, whereas you've got a large vastus medialis muscle there. Both tibias have got a varus position at the distal shaft, and I noticed that there's a little bit more bulk of the calf muscle on the right side. If I then also observe that the feet are probably in a pronated position, I'm looking from the side, looking to see if there's any gross deformity of the spine. Seems to be a normal lumbar lordosis, and the hips are in a normal, relatively neutral position. There's no recurvatum of the knee, no hyperextension of the knee. Observe from the back as well, and observe from the opposite side. Okay, I'm going to take you back to the plinth, Mark. What I'd like you to do is just to lie back on the plinth for me. Okay, so I'm just observing once more. I notice that there's a little bit of possible swelling on that left knee. Is there any pain with that left knee, Mark?
No, thank you.
Okay. Okay, I'm now going to examine for fluid on Mark's left knee. So I'm just going to push down on Mark's quadricep, and we will move the fluid we can see upwards. Then push it down laterally. You can see that fluid reaccumulate on the medial side. Did you catch that on the camera? Okay, I'm just going to bend your knee, Mark, a little bit if I can, and feel around the joint margins. So I'm looking for the sponginess of synovitis. Can you let me know if there's any pain, Mark?
It's fine, thank you.
Okay, I'm just locating the tibial tuberosity. In children, particularly girls around the ages of 12 and 13, there can be some tenderness. Osgood-Schlatters disease, traction, periosteoitis. And I feel around, palpate around the patella itself. Any pain, Mark?
No, it's fine, thank you.
Noted. And I would repeat that on the opposite side. I'm just going to get the patient to move the legs. Can I get you to bend your right leg, bring the heel closer to your backside, Mark? Okay, and straighten. Okay, I'm just going to do that myself. Okay, Can you do the same on the opposite side for me, Mark? And straighten. Okay. Could you raise your left leg off the bed for me and slowly lower down? Same with the right. So what we're looking now is to see if there's any evidence of quadriceps tendon damage. As Mark was able to raise his leg straight off the bed, there was no evidence of that. I'm going to carry out some ligament tests now. So I'm just going to take the weight of this leg a second, Mark, if I may. And I won't hurt you, and I'm just going to place the side of my hip on your foot. Now, grasping the patient's calf muscle and looking at the tibial tuberosity, I'm going to move and pull that limb forward. I cannot see it moving towards me, so the anterior cruciate ligament is intact. I'm going to push back, and I cannot see it moving away from me, so the posterior cruciate ligament is intact. I'll do the same for the opposite side. Okay, anterior and posterior cruciate ligaments intact. I'm going to take the weight of your right leg, Mark, and pushing on the femur and pulling on the tibial segment. I'm going to test the integrity of the medial collateral ligament. Okay, no excessive movement there. Switch hands, and now I'm testing the lateral collateral ligament. And repeat for the opposite side. There is a little bit more movement available from the medial collateral on this side, and the lateral collateral is very stable. So I'm now going to carry out a meniscal integrity test on Mark's right leg. I'm just going to take the weight of your leg, Mark, if that's okay. So I'm going to place a valgus stress on the knee and flex and extend. Any pain, Mark?
No.
And I'll place a varus stress on the knee and flex and extend. Any pain, Mark?